Hello, good morning everyone. Today we'll see the bedsore. Bedsore is the term applied to the local gangrene or a ulcer caused by certain conditions associated with the confinement of the bed due to the constant pressure circulation becomes slow and finally death of the tissue occur. And there is a purpose of why we are giving the bedsore care to improve the circulation, to facilitate the healing, to prevent the infection, and to prevent the further damage, to treat the bedsore. Causes of bedsores are direct or immediate cause. The pressure is caused by the weight of the body continuously remaining in one position, splint cast and a bandages. Second one is the friction. Friction is the skin with a rough bedding cause injury to the skin. The friction is caused by wrinkles in the bedcloth, cramps of the foot in the bed, clips and rough bedpans and hard surface of the plaster cast and splint. Then comes the moisture. The skin contact with the moisture for a prolonged period can lead macerations of the skin. Then comes the pressure of the pathogenic organisms. Due to the unhygienic condition, pathogenic organisms multiplies and infection settles on the skin. Then the predisposing factors. Patient with a long-term illness, fracture patient, patient with a spinal injury, then paralysis and limited movement, emaciated and malnourished patient, elderly with a circulatory problem, obese patient, edematous patient, patient with a incontinence, diabetic patient with a ulcer. Then common site liable to get the bedsore is in supine position, occiput, scapula, sacral region, hip and elbow. Second one is in sideline position, ear, acromion process of the shoulder, ribs, greater trochanter of the hip, medial and lateral condylence of the knee and malleus of the ankle joint. In prone position, ear, cheeks, acromion process, breast in female, genitalia, knee and the toes. Then there is some clinical manifestations also for the pressure sore. Pressure sore, that is redness, heat, tenderness and discomfort in the area. The area become cold to touch and insensitive. Local edema, lateral, the area become later the area become blue, purple or a mottled. Due to the continuous pressure that circulation is cut off, the gangrene develop and the affected area is sloughed. Then comes the prevention, how we will prevent it from the bedsore. Confirm the high risk patient and daily examination for the sign and symptoms. Relieve pressure by the using special mattress, bed and comfort devices. Change position and giving with care 4 times a day for all bedridden patients. Losing tight bandages and restraints. Avoid friction by providing smooth, firm and wrinkle-free bed. Keep the bottom cloth free and from crumbs and the foreign bodies. Prevent moisture by changing linen when it is wet or soiled. Giving back care to patient immediately following mixturation and defecation. Avoid mechanical or physical injury to the skin from improper fitting of prosthesis or from burn caused by the excessively hot or cold application. Use a bed cradle to lift the weight of the bed linen of the patient to enable him or her to move in bed freely. Supply well balanced diet and adequate fluid to maintain the general health of the patient. Then comes the sign and symptoms of the pressure sore. First degree, skin is red, tender, inflamed and painful. Second degree, the skin will be blue or mottled, insensitive circulation cut off, gangrene develop and epidermis breaks. In third degree, suppression and sluggish occur which may burrow right down to the bone. Then curative measures we will see in first degree detect the early sign and symptoms of the bedsore and report them to the sister in charge and to the doctor. While giving the back care, massage do not cover the reddened or inflamed area it's itself, but start just outside the affected area and move outward in the circle using the circular motion. Second degree, if the pressure sore is blue or mottled, insensitive circulation cut off, gangrene develop or epidermis breaks. The treatment include information and report to the ward sister and physicians, prevent the ulceration area from infection, use normal saline for cleaning the area. Sloughing is more, use hydrogen peroxide solution also for a cleaning cut of the slough. Then apply heat for the healing of the wound. Use 100-watt electric bulb for a 10 minutes. Apply the zinc oxide ointment on the surface of the wound. Then in third degree, inform the report to the ward sister and physician. To treat the infection, apply the soframycin ointment locally and gives systemic antibiotic after the culture and sensitivity. Provide the nutrition diet, sunlight and fresh air. If slough is prevent, clean the wound with a hydrogen peroxide twice daily. If the slough is loose, it may be cut off. If there is delay in wound healing, skin grafting can be done. After the bedsore care, we have to place the patient in a comfortable position and use proper and adequate comfort devices. Change the patient's position frequently as per 2 hourly. Then remove the articles from the bedside and replace it in proper place. Hand washing. Then recording and reporting the date, time, types and pressure sore and treatment of the nurse's record. So I think you understood the bedsore and care of the bedsore. So if whenever it is necessary, you can do the bedsore care or pressure points. You can apply the pressure and help to the patient. Okay, bye bye.